we brought our speaker in, and we really need to give her a chance to say a little bit.
Sorry.
This is too important. Sharon, you can connect with Ken afterwards, okay?
Okay.
Our speaker today, and we just modified her speech. Alyssa Harris is the director of the Department of Health here for Rowan County, and there are all kinds of questionnaires and data and information that they pull together so that they can adequately respond to specific needs. This is a need-based kind of operation, like serve people. Would you believe government is put in place to serve people? A lot of hard-working folks there. Alyssa is at the head of that chain, and Alyssa, I'll just turn it over to you. And I know she has another appointment, but give us what you can.
Yeah, absolutely. Thank you, folks, for letting me share your time this morning. I have a whole lovely presentation, but Jeffrey can send it out. So I won't go through all of this. I do want to just highlight a couple of things as we get into our conversation about what is going on at the federal level and how that impacts us locally here in Rowan County. So you'll see me skip through a bunch of slides. Again, you'll have this data. I do want to say just as...
Yeah, I'm just trying to make sure that this is actually...
That's in Amsterdam, if you want to take a trip to
Amsterdam.
There we go. There you go.
Okay, here we go back. Just a couple of things, kind of backtrack. So I do have the privilege of serving as the Rowan County Health Director here, which means I'm over things like chronic disease, children's health, women's health, maternal health, dental services for children, environmental health, including septic permits and food and lodging inspections for restaurants and nursing homes and schools and pools, and a variety of services. About 60% of our budget is not funded by the county. And I think a lot of people don't know that, is the majority of our funding comes from Medicaid dollars, either from the federal government directly or feds to states to local. And then we are somewhat funded by the states, although not much. And I'll talk about one of the issues that we're seeing around communicable disease. But I think it's really, really important that if only 35% of my budget is accounted for by county dollars, what that could mean for us in the future when it comes to public health. We're continuously seeing the encroachment of deregulation for things like environmental health. So, pushing things out to the private sector, whereas we're focused on really protecting the water table, protecting the future health of this county so we can continue to have, healthy places to live. Sorry, if I get away from the mic, just holler at me. So as I look at what's going on at the Fed level, at the state level, I am nonpartisan. I am here to serve. I'm a civil servant. I come from a long line of folks who serve. My father was in the military. My mom is a current teacher's assistant for special needs students at Rowan Middle School. My brother and siblings, all of them are in the military. So my heart is in service, and I'm from Rowan County, and I want to see Rowan County thrive and be a healthier and happier place. So I am concerned. I'm concerned about what's going on and just kind of looking to the future for what projections I might have to do for the services that we can offer our most in-need populations. One of the things I was going to discuss is what is Rowan County's state of health. I will say we are currently going through the community health needs assessment process. April 22nd from 2 to 5 p.m. at the Rowan Community Center, there is a community forum. So please come and share your voice if you want to help vote on what those priority areas are. And again, I'll send that to Jeffrey to get the flyer out. We already have about 50 people signed up, which is fantastic. We have different young people involved, hopefully getting the voice of the whole community. So we may see some things change and more data coming, but what I want to say to you right now, very briefly, is that Rowan County is getting healthier. So listen, hear that. We are getting healthier. I started back in 2016 with the Coalition Healthier Rowan, and Rowan County was ranked 76th out of 100, with 1 being the best and 100 being the worst. We were ranked 76th for our health outcomes. That meant people who live here just by living here, we're more likely to have a shorter life expectancy and poorer health than those who lived in the counties that surrounded us, especially Cabarrus County. In that same time frame, Cabarrus County was ranked 13th in the state. So you think about the underlying factors of that, and I'm very, excited to hear that housing will be discussed, economic development will be discussed, because all of those are the foundation to good health. We cannot expect anyone to be able to afford their medication if they can't afford their rent. We can't expect people to be able to be in good health if their houses are substandard, if they have black mold, if they're not well insulated. So those are great foundations of health to think about. Where we are today, and just very briefly, is we're closer to the national and state average, so that 50% mark. And I never thought I'd celebrate being average, but I will take it over being in that lower quartile. That's fantastic. That means that our citizens are getting healthier. We're living longer lives. We're having less just that impact. And I don't look at health as saying like you have to be a certain weight, you have to have a certain A1C, you need to have a certain cholesterol level. That's the outcome measures. I want to make sure people are living long and healthy lives to do the things that they want to do, to see their grandkids and great grandkids, and to really enjoy their life to the fullest. So that's the measure of health that I like to take. So all of the data that I was going to provide, we'll get into all of those different things. I do think it's very fascinating. We can break down by census tract the length of life someone may have. So your zip code has a bigger impact to how long you're going to live than your genetic code does. And so you can see the darker areas are longer life expectancy, whereas the lighter areas are a shorter life expectancy. And a lot of that can be attributed to overdoses, because that is individuals who are younger typically overdose, so that's bringing down that average quite substantially. And so these are the hot spots for where we see overdose happen in Rowan County. So again, lots of really great information: heart disease, stroke, cancers, respiratory diseases, what mortality looks like. And again, I'm happy to come back maybe at a different time when we have our latest community health needs assessment and talk about all of these things. I will again leave you with a message of hope. We have cut almost in half individuals who are dying due to overdose, due to opioid overdoses. So we are seeing a substantial improvement in fewer people overdosing and fewer people dying from those overdoses. And so I'm thrilled to share that information. And then youth impact, mental health, what we see here in the community. One thing that is on the rise is suicide in Rowan County. I will say between January and February, I had 6 reported suicides by gun violence or by gunshot wounds. And so gun violence being a very, not just crime, but gun violence in general, being a really huge issue here that isn't discussed enough. I also had 7 deaths due to influenza. Ages ranged from 35 to 80, so it was across the board. So some things happening that we may end up seeing some changes in our health statistics in the future, but this is something that I am tracking, and I encourage you, if nothing else, reach out to a friend, to a loved one, check on them, see if they're doing okay. If somebody you haven't thought about, think about them and reach out, because it can be the difference. So foundations of health, I talked about, a little bit about economic development. I'm happy to hear Rod will be here to talk about that. We are seeing positive growth, but we are seeing one of our lower, one is the worst and 100 is the best, is our adjusted property tax base per capita is on the lower end for all the services being provided. But we have a great population growth. We're seeing continued growth. We're seeing continued jobs coming in. Now, policy-wise, I would love to make sure that those jobs are providing adequate health insurance, adequate pay for those individuals, but that's outside my pay grade to talk about. Happy to have Rod talk about that a little bit more. So I want to touch on Medicaid and what is going on here in Rowan County with Medicaid expansion. So Medicaid expansion has a huge impact on your Department of Social Services for those people who process the Medicaid applications, the health department and other healthcare providers in people gaining access to healthcare and being able to actually afford preventative care for the first time. Back in 2022, we were estimating about 9,500 individuals in Rowan County would receive health care as a result of Medicaid expansion. And as of April, we're at 8,989. So we are close to what we expected for people to receive. And 100% of those people are rural. So we are really looking at how are we making an impact in the areas, not just the city of Salisbury, but the areas that surround, because about 100,000 people of our 148,000 live in those rural municipalities. So that's great. That means that more people have access to primary care, and the more people we're able to catch earlier, the fewer poor health outcomes we'll see in the future. And so the majority of those individuals are individuals 19 to 29, and then you see it kind of decreases over time. You're looking at more employer-provided insurance in this age range, and then as you get closer to Medicare, as you get older. So this is sort of the breakdown. I'll let you take that in. This is such an impact for people to have access to care, for people to be able to go to the doctor and catch something instead of having to go to the emergency department for something that has gotten much worse. It also includes dental care. A lot of people don't realize that poor dental health is, I think, the top 3 reason people go to the emergency department, and one of the worst things for children to have poor dental care. So having this access is amazing, and we're trending towards fewer and fewer people being uninsured in the community. So having that access to primary care. So as we look at the federal budget, what is currently being shared is that $880 billion that goes towards Medicaid and Medicare is expected to be cut over the next 10 years. That would be a devastating impact, not just to those individuals who just got access to care, and I wrote this down, so I just wanted to make sure I said it, but Medicaid provides so much more than just primary health insurance for individuals who are low income. It provides and covers inpatient and outpatient services at hospitals, emergency transportation, surgical procedures. It provides maternity and newborn care. I think it was 30% or 40% of births from those uninsured are covered by Medicaid. Provides pediatric services, early and periodic screening, diagnosis and treatment for individuals under 21, diagnosis and preventative services, prescription medications, mental health services, substance use disorder treatments, crisis intervention, nursing home care, home and community-based services, adult day health services, and pilots for things like food as medicine, and really meeting those foundational needs like housing and domestic violence prevention as part of the Medicaid waivers. So it is a huge concern to hear that being cut, and at the same time, we're hearing of these cuts to Medicaid. We're also seeing cuts at the federal level to our Health and Human Services Division in our CDC. Almost 20,000 staff were cut in areas of HIV, child-led prevention, newborn screenings, injury prevention, smoking cessation, and gun violence prevention. We've also seen changes to things like the ACIP, which is the committee that meets to promote and provide immunization recommendations. So if that kind of gets blocked, the opportunity to provide preventative care to prevent communicable disease also decreases. So right now we're even looking at, can we get information about flu vaccines for the next year? Locally, what we saw, there was a stop work order from HHS on any COVID communicable disease funding that was still provided. We had about $200,000 left, and immediately on March 25th, we no longer had access to those funds, and that meant that we had to let 4 individuals go that Friday.
Wow.
Devastating. These individuals were helping with referrals, with refugee health, as a community health worker, with interpretation services, and with basic IT support for the health department. It was devastating to those individuals. We knew the funding was ending. We were working through other opportunities, but to have them leave 5 weeks early, I mean, you think about the economic impact of every individual who is employed in our community and what that means for their families as well. So that's something that happened here. That means we are not going to be able to respond to community events because we have fewer staff, and that we are also sort of monitoring, okay, what will come next if 60% of my budget is funded by Medicaid and through the states. I think that is all I may want to say. The other areas, I think I covered, we're also looking at things like chronic disease, cuts to the Office of Minority Health, these words that they have decided are bad words that we need to end. We have a CDC grant called REACH, which is Racial and Ethnic Approaches to Community Health, and it helps our community, especially in census tracts with higher minority populations, ensure that we have access to physical activity, healthy foods, information about preventative vaccines. So we're very concerned that that may be cut in the future, which is another position that we currently maintain. So it is an unsure time for public health. In the mix of also, we're concerned about the trust in public health messaging. We know there's a lot of distrust as a result of COVID and sort of the disinformation that happened after that. There's a lot of vaccine hesitancy. I'm concerned about measles, as we see that we're already in 25 different jurisdictions. We've had 3 deaths. Typically, there are 3 deaths or 1 death for every 1,000 cases. We only know about 760 cases, so really there's probably closer to 3,000 cases. We do not have herd immunity for our kindergartners here in Rowan County. The threshold is 95%, and about 91% of our kindergartners are vaccinated. So I continue to worry about these things and the positions of HHS and CDC for what funding may come down if we were to have an outbreak. So it's all very interconnected. And one last thing before I go, again, I really appreciate your time and the opportunity to speak with you. But locally, or at the state level, we are watching bills for public health, right? So this is not an exhaustive list. These are things that are just at the top of my mind. You've got some great things like protecting youth from the harms of vaping and nicotine that will raise the age of being able to purchase those items to 21 and get them out of the schools, right? So a younger individual could be in a high school, could then share that vaping or cigarettes. So it's crossed over. It's got a lot of strong support. Things like more efficient Office of Vital Records, that's getting birth and death records back sooner. And then we have local communicable disease program funds. Right now, we only receive $11,000 from the state for all communicable disease in Rowan County. And so the county has to come up with the rest. And so this would provide, I think, around $300,000. And we have over 1,200 cases of communicable disease. There are 73 different reportable communicable diseases that we tackle at the health department to keep everyone safe. So these 3 bills are ones that I'm more concerned about. Various on-site wastewater well provisions. That goes into the privatization of septic systems and wells, which could have a huge impact on health if anyone were to cut corners or have some sort of idea versus the public. You know, we don't come in with a certain thought about what that should look like. We're there to protect the water table. House Bill 519 is minor's consent law or parents' bill of rights. Right now, a minor can consent to prevention, diagnosis, and treatment of venereal and communicable disease, substance use, mental health services, and pregnancy. So this law will take away everything except for treatment, as in prenatal care for pregnancy. Minors will no longer be able to go and get contraception. They'll no longer be able to go and get substance use services without their parents or mental health services. And for us, we think about those children who have been abused, neglected, who are dealing with things in their homes that will not be able to receive health care and help as a result of these changes. Whenever we're having a provider visit, there's always the conversation of how can we get your family involved? How can we help? How can we connect and help you have those conversations? It is not about pushing parents out. We want parents to be involved and promote health and well-being for their children. But there are children who do not have that support, and we want to make sure that they have hope and help through that. And then the other one is HB 89, which is a Vaccine Freedom Act, which would remove vaccine requirements for universities, which is, if I have to tell you, that's awful. And then the other one is House Bill 380, which is adding a conscientious objective to vaccine mandates. Again, adding another way to reduce the number of people who are vaccinated, reducing our herd immunity, really making us vulnerable for communicable disease here in Rowan County. So with that, thank you. Thank you for your time. I appreciate seeing everyone. And I'm I'm happy to have Jeffrey send this out, and we'll send out that more information. And always happy to talk about health.
Do we have a few?
Oh yeah, questions.
We have time for a few Q&A. Can please hand up real quick?
Real quick, I may have missed it. How many people are on Medicaid in Rowan County? Not just the expansion, but total.
I want to say it's around 40,000 individuals.
40,000 out of 140,000?
Yeah.
Yeah. Yeah.
I'm just curious, is there anything locally that y'all do that, you know, you receive directives down from the NIH about various health issues? Because yesterday Kennedy announced that they're going to find the cause of autism by September of this year. And we had 30 years of history talking that this is a genetic disorder and it's not caused by vaccines. So I'm just kind of curious if you've received anything like that.
Thankfully not. So North Carolina is a decentralized system. So it means locally, my Board of Health and I have jurisdiction over Rowan County. The state has jurisdiction over North Carolina. So we may receive funding from the CDC and HHS. We may receive, like, you can't do X, Y, and Z if you have this funding, but we can't be told to implement or do research. So thankfully.
Michael?
I'm kind of in a gray area. I'm 66 about this measles stuff. Do I need an updated vaccine for measles, or do people before, I think they said before 1957, have natural immunity because it was there? And then the people during my cohort, we're like one shot or whatever. I know I was vaccinated when I was in kindergarten, but is my vaccine still?
So you can always go and get your titers done at your provider's office. So right now we are not recommending that booster vaccine, so to speak, and that information will come out if we do end up starting to see cases come. Right now you're considered protected, but you can always get your titers. I know going through pregnancy, they actually do your titers, and I no longer was seroconverting for rubella protection, so I had to go and get another rubella shot, even though I had my 2 MMRs. So I wouldn't tell you one way or the other, but I would say go get your titers from your provider. They'll send your blood to a lab and be able to tell you what you're still protected against. Yes.
Is that presentation going to be available anywhere? Because there was a lot of data in it that I would love to look at.
Yes, I am happy to have Jeffrey send it out, and then we'll continue. We'll put it on our website, but you're more than welcome to send it out. It's all public information. I'm always happy to talk about data and talk about the interpretation of data. My one caveat is always it's a couple years removed. So you may look at something and you're like, well, that doesn't make any sense for what's going on in 2025, but that's because it's data from 2019.
All right.
Thank you all so much. Oh,
I would just say to remind people about the community health survey.
so it closed.
Did it close already?
Yesterday?
Yesterday.
Yes,
Never mind.
but stay tuned, because if we haven't reached our goal, I think we were at 1,000 or 1,100 out of 1,600 people who had responded. We will reopen it for another week. So the Community Health Needs Assessment Survey is an essential tool to help us identify what those community priorities are and then put resources behind it. We are vastly underrepresented for our men. Men do not like to take surveys. That's what I've been told. So if we are able to send that out on Monday, I'll again let Jeffrey know. Thank you, Vera. And send it to your friends. Get them to take it. Thank you all so much.